Good afternoon. I'd like to call the committee to order. We have a quorum, I assume. We have a quorum. This afternoon, our first order of business, members, is to welcome our new page to our committee. Laura Hoffman is with us. She's standing over here. Laura, if you just come in the middle here so everybody can see you. I know it's, a lot of people in the room. And I just asked Laura to introduce herself and just tell us a little bit about her so that we can get to know her a little bit.
Yeah, I'm Laura Hoffman. I grew up in Eden Prairie and graduated from the U of M with a degree in political science last May. I spent a lot of time at the Capitol last session and thought that lawmaking is pretty cool, so I wanted to get in on the action.
All right. Well, thank you. We're really glad you're here. And this is her very first hearing. So we're all going to help her and,
we'll show her the ropes.
just understand. Okay. Representative Franson is going to show her the ropes. Okay. I think that's just great. All right. Members, we're going to start with House File 1988. We did have an informational hearing on this bill, so we are going to, so I'm going to move that House File 1988 be re-referred to the Committee on Commerce. And
I have an oral amendment, Madam Chair.
Okay. And Representative Laine has an oral amendment, and what would that be?
Just simply on line 5.28. Delete provider and substitute establishment. So it would be a funeral establishment instead of a funeral provider.
Okay.
And this is a request of the Department of Health just to align with their statutory definitions.
Okay, so Representative Laine moves that, or I'd have to move, I'll move that on line 5.28, delete the word provider and insert the word establishment.
Yes.
Get it?
Yes.
Okay. Do we need to vote on that? I assume we do. Okay. All those in favor of that amendment, please say aye. Aye. Opposed? Okay. Motion prevails. The amendment is adopted. So, members, we had an informational hearing on this. This is a bill that we are going to vote on, and we didn't have an opportunity for amendments before. So, right. So, I would. Is there any discussion or any amendments? Okay. Seeing none, then I will renew my motion that House File 1988 be re-referred as amended to the Committee on Commerce. All those in favor, please say aye. Aye. All opposed, no. No. The motion prevails, and the amendment, the bill is re-referred. Thank you, Representative Laine. Okay. We're going to move now to House File 1931, Representative Halverson. And we also have before us Representative Kahn's bill, but we are not actually hearing that bill. We're going to hear Representative Halverson's bill. And so before we begin with this bill, I would like to say that it is the chair's intention to hear the entire bill and take testimony on the bill. But at the end of the hearing, the chair is going to move to remove Section 1 of the bill. And then we will vote on that, and then we will proceed, I believe, with the second section to re-refer that. So with that in mind, members, we will start, and I'll call on Representative Halverson. Welcome to the committee.
Thank you, Madam Chair and members of the committee. This bill, this issue came up for me this summer in a couple of different ways. I think if we think back historically when we first became aware of this product called electronic cigarettes and this action called vaping, it was probably within the last 6 months or 1 year or 2 years. It's a very, very new trend that we are seeing. Because of that, we've got local units of government, we have businesses, we have others that are trying to figure out how this needs to be regulated. The federal government is looking at this as well because it is a product that delivers nicotine and other chemicals into the system and into the air. So because of that, I started taking a look to see what other states have done and what other conversations are going on. Additionally, my city, Eagan, this spring, if you can call it that, has put this on their legislative agenda for the year. Local units of government, the League of Minnesota Cities, and others are looking for some real guidance in terms of how to deal with these businesses as they're popping up in our communities. And also wondering what the repercussions are for regulating electronic cigarettes. So with that, if it's all right with you, I can walk through the bill and talk about it point by point, and I know that there are some folks here who are ready to give testimony on the specifics of the bill.
All right.
So starting with Section 1, which, as Representative Liebling says, we'll talk about in an informational format, this essentially, for the purpose of the Clean Indoor Air Act, will call the utilization of e-cigarettes smoking. And therefore, it would not be allowed in public places. So in this room, for example, or in your bars or restaurants. Keeping in mind that there's a number of businesses in Minnesota that have already taken strong action to limit the use of e-cigarettes, including Target Field, the Mall of America, Delta Airlines prohibits it on their flights, and their Buffalo Wild Wings, I was there the other day, they don't allow it. There's a nice big sign there. So it's a trend that we're seeing more and more with businesses. The Business Owners and Managers Association International have gotten so many questions from their tenants. These are folks who own buildings or manage buildings about e-cigarettes, that they've taken a position as a international association to treat electronic cigarettes like cigarettes for the purpose of smoking in indoor air because of the concern about what might be in the air when this product is used. So there's a very strong, along with all the health issues, there's also a very strong local government and business interest in this particular issue. So adding it to the Clean Indoor Air Act would also mean that sampling would be allowed in stores that are expressly permitted to do sampling. So if you have a tobacco shop and you're allowed to sample your cigar products, your e-cigarette products would also be allowed to be sampled by your customers. Interestingly enough, Clean Indoor Air itself, I think many of us know, has overwhelming support in this state. About 87%, according to the most recent poll, of Minnesotans support clean indoor air. And a new poll just released today actually showed that 79% of Minnesotans support adding e-cigarettes to our clean indoor air standard. And I think that it really speaks to the fact that Minnesotans have come to expect that as a state government that we are making sure that we're providing a clean and safe breathing environment for our citizens. Moving on to Section 2, this, of course, prohibits the use in schools. It seems like a no-brainer, but if you look at current statute, e-cigarettes are not prohibited by use in our public schools. This would be a strong policy to protect kids. We're hearing more and more from teachers and administrators who are seeing this used clandestinely or not so clandestinely by students in their schools. And we're also taking a strong stance to say that we're not going to normalize this behavior of delivering addictive nicotine to our youth. Also, you won't be seeing it in the teacher's lounge, probably, Representative Morgan. Section 3 authorizes local units of government to require their retailers to retain a tobacco license to sell e-cigarettes. The reason being is because we're prohibiting their sale to minors in Minnesota, we want local units of government, and local units of government are asking to be able to perform the enforcements necessary. And so this, collecting the fee for the license will allow them to include e-cigarettes on their compliance and monitoring checks that they do around their city, since local governments are enforcing their utilization and sales.
And could I just stop you for 1 minute? Excuse me, Representative Halverson. To the audience, I believe I can smell some vaping going on in this room, and if you are doing that, I would just say that I'm going to ask you to please not do that in this room at this time. So, thank you. Representative Halverson.
Thank you, Madam Chair. The next section, Section 4. Again, this is a very proven tactic to keep cigarettes and nicotine delivery products out of the hands of kids. We do know that these are being marketed heavily to children. There are uses of cartoon characters, uses of flavors like bubble gum and gummy bear and all kinds of sweet and attractive kid-friendly flavors of these products that could be very attractive to kids using it. And we don't just know that because we know what kids like, but we also have the science to show that use of e-cigarettes by children in our schools has doubled nationally over the last year. That's a tremendous increase in use of a very addictive product. And so we know that keeping the products behind the counter and making sure that the purchaser has to go through the clerk at the counter is a very effective way to keep them out of the hands of kids. They can't be sold next to the gum or next to your candy bars. Additionally, for establishments that are exclusively selling to folks 18 and older, so those tobacco shops, they have the same open sell laws that our current tobacco regulations would have. So they can have open sell, and they continue to. Section 5, this allows local units of government to maintain their own control over the regulation and use of e-cigarettes in their own communities. Local units of government are increasingly becoming active in this issue, and they're asking the state for more clear guidance and for a statewide standard. But in the event that the state doesn't provide that, they will be allowed to do that on their own. Additionally, in Section 6, this just imposes criminal penalties to folks who are selling to kids under 18 years old. We don't want these products in the hands of minors. We don't want folks to, our young people to be starting a new lifelong addiction, which we know anybody who's tried to quit smoking knows what a tough addiction nicotine really, really is. So. It clarifies what tobacco-related devices are. We know that this is a moving and developing industry, and so we try to make it clear that there can be a lot of ways to deliver tobacco and nicotine delivery products, and we wanted to make that clear in law and define what parts of the components of e-cigarettes have to be sold behind the counter, kept behind the counter. So you can't go and buy your vaping device from on top of the counter, or you can't have that by your gum at the convenience store and then have the juice behind the counter. It all has to be behind the counter, so it just makes it real consistent. And then finally, Section 7, I believe almost finally. We expressly prohibit sales to minors, as you know. Not just with the e-cigarette device, but again, anticipating any other potential delivery products we might be having for nicotine, making sure that they're not getting into the hands of kids. So a nicotine-spiked water or whatever product there may be there. And that's the bill. I should note that sales to minors are actually illegal in Minnesota now. So this allows us the enforcement devices necessary to maintain that under the Tobacco Modernization and Compliance Act of 2010. And then additionally in 2013, the legislature took the action to tax e-cigarettes like cigarettes. So they're taxed as the other tobacco products, if you will, based on their nicotine containing components. And that's the bill. I'm happy to answer any questions or hear from testifiers.
All right, I'm not aware that any members have questions at this point, so we could probably move to the testifiers.
Thank you.
Thank you. Welcome to the committee.
Madam Chair, members of the committee, I'm Ed Ellinger, the Commissioner of Health, and I'm here to speak in favor of House File 1931 and the use of the state statute to control e-cigarettes like we do regular tobacco. I graduated from high school in the year that the Surgeon General issued his first report on tobacco and health, and so for my entire post-secondary career, I've been seeing the efforts to control the use of tobacco, and we've made tremendous progress, going from having about half of our population be tobacco users now to under 20% nationwide. And we've made tremendous progress, particularly in Minnesota, when we've had the Clean Indoor Air Act, and in 2007, when we've had the Freedom to Breathe Act, we've seen some really marked declines in tobacco use. But all along the way, the tobacco industry has responded with some creative ways to try to get around some of the efforts from the public health community to restrict tobacco use. And certainly since 2007, when we had the Freedom to Breathe Act, and other states have really recognized the importance of clean indoor air to the health of their citizens, the tobacco industry, and others who have some profit motives related to the addiction to nicotine have come up with some interesting products that have tried to get around the Clean Indoor Air Acts and have been marketing these as ways to get around some of those statutes and laws. And e-cigarettes, as has been pointed out, are a relatively new phenomenon. They really came about in 2007 and have really taken off dramatically. They're currently not regulated by the Food and Drug Administration. There are over 300 different manufacturers and no regulations in terms of the consistency of the product and the quality from one e-cigarette to another. Labeling is really inconsistent and sometimes inaccurate, claiming that they're at times nicotine-free when there really are nicotine in the product. The potential risks of e-cigarettes are really still undetermined. There's a lot of work being done to see what the risks actually are. But there are known carcinogens and toxins found in e-cigarettes, some of the same ones that are found in regular cigarettes. The vapor emitted from e-cigarettes has not been found to have been proven safe. It's really an untested product. And we're certainly asking, certainly in the public health community, to have FDA weigh in on the e-cigarettes, and I'm hoping that they will do so relatively soon. So until we know more about the long-term health effects, I don't think we can really confidently say that they are safe to use at this point in time. And without proper regulation of FDA, it's really difficult to know what other kinds of things are in and what other kind of risks that we have with e-cigarettes. And I'm particularly concerned as a pediatrician about the way that they are being marketed to children. As you've heard, they come in candy flavors and being marketed with cartoon characters with approaches that have been shown to be effective in getting children to take on products. And children particularly are really sensitive to social norms. So we're seeing, particularly with the recent surveys done by the CDC, the uptake of e-cigarettes among middle school children and doubling in a year's time is really of concern, because I don't think any of us would really like to see our children become addicted to nicotine. And the methods being used, marketing to children, and the uptake is really of concern. We're also seeing the concern that nicotine can be toxic, and we've seen increasing reports from poison control centers about calls related to nicotine poisoning. So this is a concern among children. There's also been a concern about, and lots of talk about e-cigarettes as a way of doing cessation. And there's no body of evidence that proves e-cigarettes help people to quit smoking. There are lots of approved, FDA-approved tobacco control products, cessation products, such as nicotine gum and lozenges and patches. So we don't know, and we know that they work. We don't know about e-cigarettes. And particularly, there's no way to tell in e-cigarettes what concentrations are being used, what kind of doses are being used, so that it's an unregulated product. And then oftentimes we also see that this is really a way of interfering with cessation, because we got dual use of e-cigarettes in places where cigarettes aren't used, aren't allowed, but then keeps doing dual use, both cigarettes and e-cigarettes. So we think that there is a loophole in the Freedom to Breathe Act, because people, when they put together the Freedom to Breathe Act, could not anticipate e-cigarettes coming on the market. And I think if they had anticipated that we would have included them in there. But since that wasn't known at the time, I think there is a loophole in our Freedom to Breathe Act that really needs to be plugged. Like I said, there's no body of evidence to show that the vapor emitted from e-cigarettes is safe. We really do need to minimize the use of unregulated products of unknown health risks. Also, e-cigarettes may complicate the enforcement of existing smoke-free laws, because it may be difficult to distinguish e-cigarettes from conventional cigarettes. Certainly, as the agency responsible for regulating, that becomes a real concern. E-cigarette use in smoke-free areas may make clean indoor air laws less effective at keeping children and families free from exposure to nicotine and other potentially harmful cancer-causing chemicals. And e-cigarettes actually may undermine our efforts to encourage people to quit smoking through this dual use that I talked about. So I think including the e-cigarettes in the Freedom to Breathe Act, treating them as other tobacco products, would be appropriate for the health of our society, and particularly for the health of our children. That's the conclusion of my testimony. Thank you.
All right. Thank you, Dr. Ellinger. I'm looking around at members to see if there are questions, and okay, Representative Mack.
Thank you, Madam Chair. And just a brief question for the Commissioner. You stated in your testimony there's nothing that has, there's no proof that these are unsafe. And just in my reading of this, my understanding is there's very little data on either side, just to kind of give a full picture. There's no data that it's unsafe. There's no data that it's safe. The data is missing on both sides of this product at this point. Is that a correct understanding?
Dr. Ellinger.
Madam Chair, Representative Mack, I may have misspoke. There are no data to show that these are safe. There are some data that there are chemicals in the vapors. We don't know all of what the chemicals are. We also don't know some of the things that are in the capsules. We don't know the dose of nicotine. So there's no data to show that they are safe.
Representative Albright.
Thank you, Madam Chair. And for the Commissioner, I'm looking at specifically line 5.16. And I'm wondering if the Commissioner could speak to, I see simulate smoking in the delivery of nicotine. My question for the Commissioner is, what if nicotine is not present? What would his opinion be of e-cigarettes or vaping in consideration of that?
Dr. Ellinger.
Madam Chair, Representative, I'm trying to think of why somebody would want to vape if there's nothing in there. And since we don't know what's in some of these capsules, we don't know, we haven't done the analysis of these, they're not unregulated, I would really not know what would be in there and determine that there is nothing. And we've also known that people have claimed that there are nicotine-free, and when they have tested those, nicotine was present. So I just don't think that we have confidence that there are no chemicals in these packets.
Representative Albright.
Thank you, Madam Chair. With regard to vaping and the usage thereof, is there any desirability to use that as a mechanism for other substances, either of a medicinal nature or otherwise?
Dr. Ellinger.
And Madam Chair, Representative, my understanding is that vaping machines, vaping implements can be used for the delivery of other substances, and that can also be a concern.
Representative Albright.
Do you know, thank you, Madam Chair, do you know of any other studies underway that would go to the heart of the substances effectively in the vapor itself?
Dr. Ellinger.
Madam Chair, Representative, I understood our request to the FDA is to have these regulated so that they would test all of these chemicals. I don't know of all of the research that is being done across the country in terms of identifying what the products are. I do know people are looking at them as to see if they are effective or not in cessation, but I don't know of studies that are being done looking at the chemicals themselves. That would be a responsibility of the FDA to do those kinds of tests and make that a requirement.
Okay, and Dr. Ellinger, along those lines, I don't know if you know or Representative Halverson, so are the cartridges labeled with their ingredients so that the user can know what they're putting into their lungs and what they're presumably putting out into the air for other people to breathe? Dr. Ellinger?
Madam Chair, I don't believe they're labeled. I have not looked at them. Do you know if they're?
Representative Halverson?
Madam Chair, there are some labeling that takes place in terms of letting a customer know how much nicotine is in the product. As Dr. Ellinger said, we don't know. We found those to be faulty as they've been tested and studied. The CDC has taken on taking a look at what's in the juice versus what's labeled on the outside, and have found discrepancies in terms of nicotine levels. They could be much higher. They could be lower. It's the much higher that's concerning because it can be toxic. And additionally, the CDC has, to Representative Albright's question, the CDC has released studies that show that rather than the harmless water vapor that we were initially told that was in these vapors, it's actually, they found heavy metals in there. They found nicotine. They found antifreeze, diethylene glycol. They have found formaldehyde, numerous cancer-causing chemicals. So they're there. What that means for our health it remains to be seen, but I would suggest that we would probably not choose to ingest these on a regular basis if we knew what we were taking in. If we, go ahead and here's your formaldehyde stick. And so more study needs to be done in terms of what the health effects are, but we do know that those chemicals exist in the e-cigarette vapor and in what the user is ingesting.
Okay, Representative Loeffler.
Thank you, Madam Chair, and Commissioner or Representative Halverson. We're all still learning about this, but my understanding, and correct me if I'm wrong, is that there's no standard manufacturing or no standard recipe, and that there actually may be manufacturers in Minnesota who come up with their own combination, or they may import it from other countries or elsewhere, and that the part of the problem in establishing harm or no harm is that there's no standardization of the product, and so that makes it really difficult to do research. Is that a correct impression?
Representative Halverson?
Madam Chair, yes, it is a correct impression. It's true that there's no labeling standard. To the earlier point, there's no manufacturing standard currently. There is a fair amount of this product that comes from China, and knowing problems we've had with everything from pet food to nutritional supplements in terms of, having harmful ingredients in addition to those. It's clear that the Chinese manufacturing process has harmed Americans in the past, and so it's kind of I keep saying Wild West. I mean, we just don't know, and the consumer doesn't know. The consumer's being told that it's harmless, but the fact is the consumer doesn't know because we haven't regulated it.
Thank you.
Okay, Representative Zerwas.
Thank you so much, Madam Chair. Commissioner Ellinger, first question for you. Dr. Ellinger, you referenced the anniversary of the Surgeon General's warning, and we're talking about the Indoor Air Act. I'm wondering, through your research into this, with the studies you've reviewed, how many deaths have been linked to vaping?
Dr. Ellinger?
Madam Chair, Representative Zerwas, I don't believe that there have been any studies that have shown the number of deaths caused by vaping. One of the concerns is that the addiction, and we know that tobacco use has caused 400,000 deaths per year. So we want to limit the use of tobacco, and the use of e-cigarettes is one way that we think he will get children addicted to nicotine, with the concern that they will then become tobacco users, and which will continue to add to the death toll that tobacco takes on our society.
Representative Zerwas.
Thank you so much, Madam Chair. Dr. Ellinger, how many studies have you read that have linked e-cigarettes to children beginning to smoke?
Dr. Ellinger.
Representative, Madam Chair, and Representative Zerwas, there is a concern. There are no studies that show a definite transfer of children to tobacco use. We have seen an increase in use of e-cigarettes by youth, a doubling in the last year. So we assume that those children will be addicted to, some of those children become addicted to nicotine. We don't know the numbers that will actually then become tobacco users, but that is one of the concerns, as we know that nicotine is one of the most addictive substances that we have, and breaking that addiction is very difficult.
Just two more questions, Madam Chair.
Watts.
Thank you so much. We talked about the idea of the dangers around secondhand smoke and the Clean Air and Indoor Air Act. Have there been any studies to show that breathing in secondhand vapor has led to deaths, like the studies that show secondhand smoke has for cigarette smoke?
Dr. Ellinger.
Madam Chair, Representative Zerwas, there have not been those studies to show the risks or what kind of harms are caused by secondhand, because we haven't done those studies, but we do know that there is chemicals, as the representative has said, that have been shown in the vapor, in the air, and those are toxic substances that we know will cause risks to individuals if they are inhaled.
Representative Zerwas.
And I guess just a final comment. You know, when the Minnesota Clean Indoor Air Act came forward, it was a lot of science behind the impact of smoking, a lot of science behind the impact of secondhand smoke, and the author of the bill and the good doctor have testified to how early we are in the process. And my concern is that this bill is putting the cart before the horse and trying to do something to prevent a problem we don't know we have. And so I'm just concerned that this is just moving too fast without any scientific basis behind it.
Thank you, Representative Zerwas. And Dr. Ellinger, just following up on those questions, how long does it take, generally speaking, between the time that somebody uses a cancer-causing substance or is exposed until, say, they would get cancer from it?
Madam Chair, the couple of issues. One is we do know about the length of time that it takes to become addicted to nicotine. And we know that particularly for children, sometimes the studies have been mostly with cigarettes. Sometimes it can take just a few cigarettes to actually get people who are sensitive to it to become addicted. Once they're addicted, then they will use tobacco, and it's a difficult addiction to break. And we know that the cancer-causing problems with tobacco and the constituents of that take decades to show themselves. But that's why we are paying the price today of the tobacco use of 20, 30, 40 years ago. And that's where the concerns are.
So, Dr. Ellinger, as I'm kind of getting this and sort of responding to Representative Zerwas, I don't think there's a lot of argument about, nobody's arguing that we have the mountains of data that we have for tobacco. But I think that the real question is, what is the appropriate balance for us as a health committee to strike when there quite possibly are dangerous substances? Remember, nobody here is asking to ban these devices. Nobody is saying that adults can't use these devices in their homes, on the street, in their friends' homes, etc. This is about whether people who are not using it should be involuntarily exposed, and whether those people should be put at risk, and what that uncertainty means. Which way does it cut? So we don't have data showing this is safe. The evidence that we're hearing now, and we're going to hear more, is that there's not even consistent contents of these cartridges. So nobody can really say for sure what's in one versus another. And we're saying, should people who don't want to be exposed be exposed involuntarily when we don't know which way this thing cuts. I think that's kind of the point we're at. So is it better to say, well, this may be harmful, but let's just let everybody be exposed anyway because we can't prove it's harmful, or it may be safe, but is it terrible to restrict it from certain places even if it turns out to be safe? And for us as a health committee, I think that's the decision that we need to make around this issue. So with that, Representative Halverson, did you want to make any other comment, or should we go on to
Thank you, Madam Chair. I could make a brief comment. Referencing the Surgeon General's report and looking back to when that was released in 1964 and what we've had to do since then. And I will tell you, I have an aunt who passed away last year, and at her funeral, she asked her daughter to implore people not to smoke and not to start smoking. She became addicted long before that Surgeon General's report was released. She became addicted when cigarettes were being marketed as safer, when doctors were endorsing cigarettes. She didn't have the evidence that we do today to know not to start smoking. And she had a lifelong addiction, and she walked around with an oxygen tank for a good part of the end of her life. And what this bill and what these regulatory policies attempt to do is to strike a balance so that we are ensuring that we're not going to addict a new generation of people. And also, I believe, to state clearly that although we don't know the extent of the harms, we do know enough to know that risk is there. We just don't know what it is. Breathing in formaldehyde, breathing in nicotine, breathing in antifreeze does come with it some inherent risk. And so we just don't know at this point how much. And I think that it behooves us to make sure that we give consumers as much information as possible before we, just go gangbusters on it. So.
Okay. So, Dr. Ellinger, any final word from you? And then we have other testifiers.
Your Representative and members of the committee, certainly as Representative Halverson has said, there was a long time before we had enough evidence of tobacco use and the harms that it caused. But as part of that, as we were gathering that information, tobacco use became embedded as part of the culture. And changing that culture is very difficult to overturn. And that's why it has taken us so long, despite the evidence that it's harmful, despite the fact that we know it causes 400,000 deaths a year. It is part of our culture, and changing that is very difficult. While we're trying to find out the safety of e-cigarettes, if it becomes inculcated as embedded into our culture, it's going to be very difficult to overturn that once we do have data that would say that it is harmful to the health of our society.
Okay. Thank you very much. Our next testifier is Janelle Waldock. Welcome to the committee.
Thank you, Madam Chair, members of the committee. I'm happy to be here today to testify in support of House Files 1931 and 1974. I'm Janelle Waldock. I'm the director of the Center for Prevention at Blue Cross and Blue Shield of Minnesota. And I'm appearing before the committee today on behalf of a coalition of health organizations that support this legislation. They include the American Cancer Society, the American Heart Association, the American Lung Association, the Association of the Non-Smokers of Minnesota, Blue Cross and Blue Shield of Minnesota, Clearway Minnesota, the Minnesota Medical Association, and many others. I'm also a veteran of the fight to pass the Freedom to Breathe Act in 2007, and several of you around the table, Representative Huntley, certainly were leaders in making that happen. It can be hard to remember the controversy that once surrounded that law, or just how many years it took it to pass. The reason it's so hard to remember, I would argue, is that because today, the Freedom to Breathe Act is one of the most popular policies our state has ever passed. In fact, every survey conducted since 2007 has found it growing more popular, with the most recent poll just conducted last month showing that 87% of people in Minnesota approve of that law. That's a very strong nod of support from people throughout the state. Other studies demonstrate the positive impacts of the law. After its implementation, the University of Minnesota tested hospitality workers for tobacco-related carcinogens and found an 85% reduction. The Mayo Clinic also found a substantial decrease in heart attacks. Additional studies demonstrate decreases in secondhand smoke exposure, as well as more people, including smokers, voluntarily making their homes smoke-free. All these studies underscore why the Freedom to Breathe Act was a good idea in the first place. It's essential that we protect the integrity of the law and the clean air that Minnesotans have come to expect and support. In fact, Minnesotans overwhelmingly agree that e-cigarettes should be included in the law's language. In this recent poll, 79% of Minnesotans said that they support prohibiting e-cigarette use in places where smoking is already prohibited. An even larger number, 87%, support keeping e-cigarettes behind the counter in stores, which is a provision that Representative Halverson also includes in her bill. The legislature can correct this loophole by taking a common sense approach, supporting the legislation that is in front of you today. Our state has enjoyed clean indoor air for 7 years, and Minnesotans have responded. This is what they want. Let's not go backwards. Thank you for your consideration and your time today.
Thank you very much. Questions from members? Okay, not seeing any. Thank you very much. Okay, we have Pat McCone. Welcome to the committee.
Thank you. My name is Pat McCone, and I am the Director of Tobacco Control Programs and Policy for the American Lung Association in Minnesota. And I, too, am a veteran, and I want to definitely thank our Representative Huntley for his leadership with Freedom to Breathe, because the dialogue around e-cigarettes and secondhand vapor and secondhand aerosol is very similar to the arguments made during that time. Similar, yet different. I had all kinds of written stuff that I was going to, but after the questions, I'm going to tell you from the heart. I brought an e-cigarette along. Some of your questions already came up, and I want to remind folks that the e-cigarette industry was originally being regulated by the FDA. The industry took the FDA to court to say, we are not a cessation device, and we do not want to be regulated as such. And they won that court case. So the warning on this e-cigarette says, these products are not smoking cessation products and have not been tested as such, period. I've taught smoking cessation for 20, 30 years, and I've had people swear to me that they've quit smoking by laser treatment, they've quit by hypnosis, they've quit by aromatherapy, but we base health on best practices and the science. I truly believe they quit smoking with aromatherapy, but it's not something we can support. As my grandson would say, I'd say to him, we have a situation, and he'd say, why do we have a situation, Grandma? And I will tell you why. Because we have Hello Kitty being marketed. This is an e-cigarette with a Hello Kitty purchased in our community. And I think maybe you were smelling the e-juice that I brought along. The most popular flavor. Lemon, blueberry, cotton candy. All right, we have a situation. We do have a situation. Addiction treatment is hard work, and it's not just as easy as this device or another. Somebody asked the question about, are there other things in these products? Just last week, and I won't reveal what county, but a sheriff, and he shared his things, said he had a probation officer come in, a person on probation come in, tested positive for meth, and the device for getting his meth was an e-cigarette. And he was asking his colleagues if this was something they were seeing. Right. So indeed, these are drug delivery systems. They are clever, they are attractive, and they are drug delivery systems. I also want to say that it is the Wild West out there. I dare you to try to read this label. We don't know what's in these. They're unregulated, they're marketed, they're mixed together in back rooms. You could mix one in your trunk of your car and sell this product. So we need the FDA to regulate that. In the meantime, we need to keep local control by the state setting a minimum health standard of exposure to these unknown chemicals. So most of the e-cigarette use in these shops are what are called the minor leagues. But in my long history with the tobacco industry, they are the major league hitters. These convicted racketeers are buying up and developing their own e-cigarette lines. I will repeat that. The tobacco industry are convicted racketeers, and they are marketing the future of nicotine addiction to my grandsons. Let's say we have a situation. History is repeating itself. E-cigarette makers, large and small, are using the same tactics as the tobacco companies did generations ago. Sex in ads, cartoons, candy flavors, advertising on TV, getting celebrities, free samples, teaching you how to use the product, to endorse them as e-cigarettes at events. All things known to appeal to kids and teens. There is a fact sheet in your packet showing the now and then ads. It's colorful. And I honestly wish we had put the ad in there of a woman who's older than me, which is pretty old.
Excuse me, I'm sorry, I don't think we have that, members.
The packets?
Were those, right, right, if you have them, could you just hand them out? Thank you.
Great. Well, it is the now and then of advertising. And unfortunately, or fortunately, or probably as offensive as the most offensive was, a blue e-cigarette ad isn't on here. But it was an elderly woman giving us the finger saying, here's to you, smoking vans. That's what this is all about. It's renormalizing a behavior that, as Dr. Ellinger said, we denormalized. Do we want this back? Puffing away and our kids asking what's that and how cool it is? I don't think so. The jury is out on e-cigarettes, way out. As one cessation counselor said to me a few weeks ago, good thing these devices weren't around when I quit smoking, because I never would have. Given all the things we know, let's put these simple, common sense restrictions on the use of these devices in public places. Thank you.
Thank you very much. Questions from members? And the document she was discussing is just coming around. Okay, I do have a question. Ms. McCone.
Yes.
I'm smelling the vapor, I think. Is that coming from what you have?
I don't know. There are people in here with devices. They have testified and used these devices in other communities and can stealth vape. So I can't assure you that it's whose vapor it is.
All right. Well, thank you. Well, let me just say again to anyone in the room who may be using one of these devices, it is against House rules to use that here. And so I would ask you again to please, if you are using one, to please desist, because I am very sensitive to scents, and I am definitely smelling that off and on here. So please don't use it here.
Lemon, blueberry, cotton candy.
Okay, thank you very much. Next testifier is Cap O'Rourke. Welcome to the committee.
Thank you, members. My name is Cap O'Rourke, and for the record, I represent the independent vaping retailers of Minnesota. So this is an organization comprised not of big tobacco companies. My clients are retail shops and distributors based in Minnesota that deal with vaping products. Just a little information. So this is obviously a booming industry or growing fast. There have been over 200 shops that have applied for a license in Minnesota in various communities. And there's a lot of disagreement about whether or not some cities give licenses or not. So there is definitely some area for added regulation. My clients support largely some of the regulation pieces that are in Senate File 1931, limiting to minors. My retail shops do not allow minors into their shop. They do not sell to minors, even products that are not currently banned. As far as products, a lot of the products that are used in Minnesota are actually made in Minnesota, and part of the reason of that is due to our current tax structure. We tax vaping products at an OTP rate of 95, wholesale rate of 95%. So financially, it's actually better to buy a product that is made in Minnesota as opposed to shipping it in from China or even other states. It's a cheaper product to have made and retailed in Minnesota. Most of the groups of my clients that actually create the product themselves rather than just retail it, the compounds that are in there are propylene glycol, vegetable glycerin, and flavoring. There is studies out there that it's certainly sure that we do not have nearly the knowledge and the scientific background about vaping and its health concerns that we did with cigarettes. But some of the studies that have been more recent and more comprehensive actually certainly show that they have a better health impact than cigarettes. And in fact, a number of them showed some very promising things for the overall health. I'm going to let one of our shop owners testify, Jesse Smith, here about his business.
It's Jesse Griffith.
Or Griffith, sorry.
But that's a pretty close name. Hi, I'm Jesse Griffith. I'm incredibly nervous, so forgive me.
Welcome to the committee.
Thank you.
And, could you...
Jesse Griffith, Griffith.
Thank you.
Well, one of the things I wanted to say was that, with regard to the bill, that there's stuff in here that we certainly agree with in terms of making an effort to keep electronic cigarettes and vaping products out of the hands of minors. Currently in Minnesota, it is only it's only illegal if I sell you the product that contains nicotine. In other words, I could sell you an accessory such as a battery or another piece of a device if you're a minor. But I think what you would find is, certainly if you came to our shop, as well as many of the other responsible retailers that exist in Minnesota, is that they would deny service to anyone. And in fact, if we see a minor walking through the doors, we're gonna reject them. As a parent, that's something that I'm concerned of as well. The other side of that we kind of talk about a lot is the whole idea of flavors and marketing to children. The reason I started my business is because I started vaping and using electronic cigarette to switch off of cigarettes about a little bit over 4 years ago. And from my personal experience, if I don't know how many of you are current or former smokers, but cigarettes taste pretty terrible. They don't taste very good. And I think that part of the reason that we smoke them for so long with the flavor that they have is because we know that it kind of kills our taste buds. But to me, when I use an electronic cigarette flavor that tastes like a cigarette, and this doesn't go for everybody, but for most people, you find that people who stay with vaping, they transition to flavors that are unlike a cigarette. And so for me, if those flavors weren't there, I would be more likely to go back to cigarettes, and that's certainly not what I would like to do. To hit another point regarding this specific bill, we think that, and it was testified by Mrs. Halverson, that it would be left up to, that sampling would still be able to occur in shops where electronic cigarettes are sold, and that's only kind of half the truth, because what would happen is, or the Clean Indoor Act has a provision that says, well, cities can go ahead and say you can allow sampling or not allow sampling. It leaves it up to the city. And so what you would have is basically a number of businesses like our own, which are kind of predicated on the idea that people trying to make a transition from cigarettes to vaping, we have to let them see what it's all about. Many of those shops would not be able to operate business the way that they currently do. It would represent a very fundamental change. And so we think it would be best left up to business owners. Mrs. Halverson described a number of businesses that have taken that kind of action, saying, we don't want this here. And we say, good, that's your right to say we don't want this here. And we're not going to put up a fuss about that. But we think that we should certainly have the ability to do it within our own businesses and let other businesses decide for themselves.
Okay, thank you. If I could just follow up on that point. So I'm sorry, I was distracted for just a second, but you're saying that you're concerned about allowing the sampling within the stores. Is that what you're
Correct.
Okay, and I just wanted to ask Representative Halverson, does your bill prevent the sampling that he's talking about?
Madam Chair, it does not. It does not actually deal with sampling at all. The sampling exemption was written into the state's Clean Indoor Air Act, and this bill does not amend that at the state level. It does not preclude local governments from taking a different action, but at the state level, we make no changes at all.
Okay, so Representative Halverson, if your bill was to become law in its entirety, his customers can still come in and try out a device if they're adults, correct?
Madam Chair, if his customers are allowed to sample the devices in his store today, they would be allowed to sample the devices after the passage and enactment of this bill.
Okay, thank you. Okay, anything further or any other questions?
I would just like to, on the health piece, it is true that we do not have the amount of studies that we did with cigarettes, but there have been some recent studies that have been some fairly eye-opening conclusions. One of them was done recently in Drexel, and I can provide these studies to all of you. And their conclusion was analysis of the current state of knowledge about chemistry of liquids and aerosols associated with e-cigarettes indicate that there is no evidence that vaping produces inhalable exposures to contaminants of the aerosol that would warrant health concerns by the standards that are used to ensure safety of consumers. There are a number of other smaller studies that show, how the nicotine is ingested, how you get nicotine from a vapor as opposed to, like, for example, Nicotrol, which is an FDA-approved cessation device. It's the exact same way that you get the nicotine. You inhale it. There's no difference in the way your body absorbs those two items. And finally, I think I would leave you with the comments of, before we go, I know there's some consumers here that want to speak as well. But Charles Connor, who was a past president and CEO of the Lung Association, he said that he tried all his life to get his mother off smoking without success. I just buried her in December due to the failure of her lungs, undoubtedly due to cigarettes. I am deeply committed to eliminating tobacco cigarettes from the American scene. The smoking rate did go down a lot, but it has plateaued around 20%. So that's been a great frustration to the public health organizations. Might not these e-cigarettes and vaping be the things that get America off cigarettes? E-cigarettes are not necessarily health products, but they are sure a lot safer than a tobacco cigarette, and even opponents say that. If FDA's overall job is to regulate the tobacco industry with a view towards reducing its consumption and reducing the number of deaths, I think they need to take a look into consideration the role the e-cigarettes might play in doing that. My clients understand that the FDA has been looking to regulate that, and in some instances, there's been trickles of information coming about how the FDA may regulate creating some of these liquids. And a lot of my clients have been trying to keep up with that and keep up those standards before those regulations come out. You can't make the FDA move any faster than it currently is, apparently.
Okay. I have a question from Representative Albright.
Thank you, Madam Chair. And for Mr. O'Rourke?
Yep.
I'm trying to get my hands around in terms of the size of your industry in the state of Minnesota, in terms of, could you give me some factual information from the perspective of the number of stores or enterprises that are out there, and from an industry perspective, I'm sure you probably cataloged or started to collect data in terms of what type of revenue on an annualized basis your industry creates in the state of Minnesota?
Representative Albright, I would love to be able to give you some of that stuff, and I will work to get you that information. This industry is extremely new, and they are still kind of creating coalitions as we speak. The best knowledge that I have as far as the number of what we have in the state is the number of there are 200 vaping licenses, according to, there have been 200 vaping licenses applied for within the state of Minnesota. But we are not sure of total revenue of those shops, and if they're all just vaping shops, if some are gas stations and retail stores, or they run the gamut of kind of where they all are. So we're trying to add to that information. I can tell you as just a practical note as far as dollars, a bottle of e-liquid, if you are a pack-a-day user, should last you a month.
It depends on the amount, but on average.
Yeah, we have to do this in a formal
Okay.
way. Sorry. Mr. Griffith,
Yep.
go ahead. Speak into the mic, please.
Well, okay, so in general, there's a bunch of different styles of devices, and some are meant to produce more vapor, but give you less nicotine concentration in that vapor, if that makes sense. But for kind of what a regular starter kit would be, usually a pack-a-day smoker is going to go through a bottle that costs $20 in roughly somewhere between 20 days and 30 days, if that makes sense. So if that user were spending, let's see, if a pack of cigarettes were, they're about $6.50, $7 now, so $210, that person's budget is now in the $20 to $30 range. I don't know if that answers your question.
Representative Albright.
No. So are you required to apply for and receive a separate license to sell e-cigarettes?
Yes, that's correct.
Mr. Griffith, go ahead.
I'm sorry. Yes, that's correct. We are by this Minnesota Revenue, and there is some confusion within cities currently whether or not they're supposed to issue a dedicated vapor product retailer a license. But if you go to the Minnesota Revenue website, it's pretty clear that it says they shall issue. So yes, we have licenses in every municipality in which we operate.
Representative Albright.
Thank you, Madam Chair. When was the first, and this may be for the Commissioner, I'm not sure if you can answer this, Mr. O'Rourke, but when was the first license issued?
Mr. O'Rourke, can you answer that? No. Okay.
I cannot answer that.
Okay. I don't know if anybody here is...
Madam Chair, maybe just,
Representative Albright.
thank you. Suffice to say, the industry itself is in its infancy. Would that be correct? I mean, it's pretty clear you don't have the numbers to provide in terms of revenue or taxes.
Wait, another time.
Taxes
Sorry, ma'am.
provided on your product.
Mr. O'Rourke.
Madam Chair, Representative Albright, I would, from my conversations with my clients, I would suspect that at least 80% of the shops that have opened in Minnesota have opened within the last 12 months. People are quickly choosing this product over cigarettes, and that is driving a lot of the boom in new shops opening.
Okay, Representative Loeffler.
Thank you, Madam Chair. And Mr. O'Rourke, you said that there's about 200 independent vapor retailers that you represent. And could you tell me if you have knowledge of how many are actually creating their own liquid? How many manufacturers do we have in Minnesota?
Mr. O'Rourke.
Madam Chair, Representative Loeffler, let me just clarify that. We have heard from the Department of Revenue that there have been over 200 licenses applied to. They are not all my clients. Some of them may be other types of shops and businesses. I am not sure exactly how many manufacturers we have, because there are manufacturers that create these products and then distribute them to retail shops, and then there are some that have a retail shop and they manufacture within. So they kind of have different levels of, and those same shops that create product for their own shops may also distribute to other shops as well. So I don't have a handle on exactly how many we have that manufacture in Minnesota.
Representative Loeffler.
And, Madam Chair, Mr. O'Rourke, do you have, can you give us some information about, or how we could obtain information about the manufacturing facilities that are putting this together? Are they done in commercial kitchens? Are they in laboratories? I think, we, as a health committee, deal with a lot of licensing of food issues and sanitation practices, just because food outbreaks and other illness outbreaks are a concern to us and increase our health care costs. But can you tell us something about the manufacturing, and is there anyone who keeps track of who those are, who licenses them, so that we could get some knowledge about that part of this business?
Mr. O'Rourke.
Madam Chair, Representative Loeffler, I do not believe, I have seen some of the manufacturing locations, a handful, just in quick tours. There is not a defined set of standards. The shops that I represent all have a separate, will have a separate room, a separate area that they maintain at certain levels, and a lot of them have been trying, before the FDA comes out with regulations, there has been some, I don't want to say leaks, maybe, suggestions of how they may want to regulate the rooms in which they're the manufacturing. And so a lot of my clients have been trying to keep up with those levels, thinking that that is the impending kind of standard that's coming. But right now, there is no one that checks that, and there's nothing, there's no regulations for the shops to adhere to.
Well, Madam Chair, I think
Representative Loeffler.
Just a concluding comment. We've had some real issues in this state with people with compounding pharmacies getting mold and other things that have actually caused long-term serious health problems for people. And this is an area that I have some real concerns about.
Thank you. Okay. And just before I go to Representative Johnson, who has a question, just want to let folks know this hearing is supposed to end at 3:45. At that time, we're going to recess. Just so people know, we're going to come back, we hope, at 6:30 this evening. We have to finish this bill. We have other bills on our agenda. The DFLers are going to be caucusing before that, so I'm just kind of giving everybody it'll be 6:30 or call of the chair, and we'll try to keep Representative Mack for sure in the loop so that, we don't go too late and keep everybody on the hook, but I just want to kind of lay that out before we conclude. Representative Johnson.
Yeah, Madam Chair, thank you. Mr. O'Rourke, just a couple of comments you made that I want to follow up on. One is a couple of minutes ago, you identified that there can be health benefits from using these products. Can you identify what those are?
Mr. O'Rourke.
If Representative Johnson, Madam Chair, if I said there may have been benefits, I may have been citing some of the studies that have said that the nicotine levels in your blood go up at a different rate when you use an e-cigarette or vapor as compared to a regular cigarette. So if you are currently a smoker and you use cigarettes, your blood nicotine level will spike upon using a cigarette, and it does two things. And then when you use an e-cigarette, it does not barely spikes or barely goes up at all from your normal level. And one of the things that does is it reduces the kind of urge to smoke again. But I want to be clear and on the record, and I am not saying that e-cigarettes are a healthy, that they're not going to make you fit and slim or do anything like that. I think a lot of our clients, customers, have chosen to use e-cigarettes and compared to use vaping and compared to cigarettes, but this is not something that I'm promoting as a healthy thing.
Madam Chair.
Representative Johnson.
And then the whole topic of choosing e-cigarettes over what I would call regular cigarettes, how do we know that people are choosing e-cigarettes as a substitute for cigarette smoking?
I will wait until further testifiers who I think will make that point.
Okay. All right. I have a couple just real quick questions for these two testifiers before we finish here. So, Mr. Griffith, you mentioned about you and your folks in your industry being careful about sales to minors. I just wonder, do you card people, or how do you know they're a minor? Could you tell us that?
Yes. So we do card, and that's usually when you apply for a tobacco license at one of these municipalities, they're going to send out sting officers to make sure that you're doing what you said you're going to do. And so it's important that we have a training program with our employees to make sure that they're carding, to make sure that it doesn't get into the hands of minors.
Okay,
yes.
Thank you. And then for Mr. O'Rourke, so you're talking about studies about what goes into a person who's vaping, but I think we're kind of interested here in what comes out that other people might have to breathe. And I just want to ask you, are you telling us that there's no nicotine in the vapor? Or I may have missed that, but is there nicotine, or can there be nicotine in what is exhaled or what comes otherwise out of the device? Mr. O'Rourke?
Madam Chair, and I have been reading study after study after study for the last probably week and a half, and I'll have to get back to you on that because I'm not sure if I can remember if they said the levels of if there's nicotine in the vaping or not.
Okay.
I have not seen a study that says there are harmful levels of contaminants in the vaping. I haven't seen anything like that.
Okay, and Representative Halverson wants to comment on that.
Madam Chair, to your question, the CDC issued a report that said that indeed they did find nicotine in the vapor. So, to your question, that's what we know.
All right, thank you very much, testifiers. We have Mr. Bryant, and I'm sure that in the next 10 minutes we're probably going to not finish up, so I'm going to have to ask the other testifiers to hang around for this evening. Representative Halverson, did you have a comment?
Madam Chair, if I could just, as this testifier is getting settled, if I wanted to just make a point to Representative Albright's questioning about the businesses and just recognize that this bill has additional stops, and government operations and commerce will be those stops. And so I think those were really great questions about the businesses and the business impacts. And the intention of this bill is not to interfere with adults buying these products. It's not about the current customers, if you will. It's about the emerging customers and the new customers, which are children. So.
Okay, thank you, Representative Halverson. And also, members, I'm not sure if I actually moved the bill, so I'm going to do that now. So I'm going to move that House File 1931 be re-referred to the Committee on Government Operations, just in case there's any doubt about where it's going next. Okay, we'll get that out of the way. And welcome to the committee.
Thank you, Madam Chair. Members, my name is Tom Bryant, and I am the Executive Director of two different trade associations. One is the Minnesota Wholesale Marketers Association, and that's a group of tobacco wholesalers located around the state. The other is the National Association of Tobacco Outlets, which is a national trade association for retail stores that sell tobacco products, more traditional tobacco stores, convenience stores, gas stations. The associations I represent do not oppose certain sections of House File 1931 that deal with, for example, the prohibition on the sale of e-cigarettes to minors, doing the compliance checks, including e-cigarettes as a part of the licensing. We're familiar with those. Our retailers comply with those regulations already on all other levels of the tobacco products, so that is not a concern of ours. Retailers have taken significant steps to make sure that tobacco products don't get in the hands of minors, and so we don't have those same concerns with those provisions of Section 1931. There is one provision, though, and there's been a lot of testimony, so I'm going to try and be brief, that we want to share our concerns with you, and that is about the section that would change the definition of smoking under the Minnesota Clean Indoor Air Act and not allow the use of e-cigarettes in many public places, bars, restaurants, bowling alleys, taverns, etc. Last week, Charles Connor, he's a former president of the American Lung Association, who is now a consultant to an electronic industry tobacco trade association group, wrote an article about e-cigarettes and about the city of Los Angeles. They're considering doing the same thing that you're considering now, is not allow them in public places. And I thought my concerns parallel his. And given his prior experience as the president of the American Lung Association, I thought I'd just read several excerpts from his article, and I have those to hand out here as well. He says, a proposed ordinance being considered by the Los Angeles City Council would impose restrictions on e-cigarette use in public places. Such restrictions make sense for traditional tobacco products. But this proposal is misguided because it would do a public health disservice, discouraging smokers from switching to less harmful electronic cigarettes that do not combust tobacco and therefore do not create secondhand smoke. E-cigarettes may deliver nicotine and look like cigarettes, but the similarities end there. Combustion of tobacco has long been recognized by the public health community as the real danger of a conventional cigarette. The lesson is crystal clear. Different products require different regulations. We have a good understanding of the contents of an electronic cigarette and the vapor it produces. Scientific research continues, but to date appears to indicate that the harm from e-cigarette vapor is minimal and negligible compared with smoke from conventional cigarettes. Including e-cigarettes in the city smoking ban would be a step in the wrong direction. It would send the unintended message to smokers that electronic cigarettes are as dangerous as traditional cigarettes, locking many smokers into traditional cigarette use. This is a public health outcome we do not want. The Food and Drug Administration will soon begin developing a policy to regulate but not ban electronic cigarettes. Comments from federal officials point toward a policy that will treat cigarettes, e-cigarettes, as separate and distinct from conventional cigarettes. In short, members, we agree with Mr. Connor that it's somewhat premature to ban the use of e-cigarettes in public places. There's been a lot of discussion here today about the FDA. The FDA has a Center of Tobacco Products. It was created in 2009. The director of that Center for Tobacco Products is Mitch Zeller. About 2 months ago, he announced the creation of 14 tobacco research centers for the FDA, and they funded it for the first year with $53 million to do the research on tobacco products. And he specifically referred to research on e-cigarettes. What's contained in the liquid? What's contained in the vapor? Do there have to be good manufacturing practices, etc.? And he said sound public policy has to wait until the science is done. You need the scientific research in order to make good public policy, because you have to do it the right way. So I would defer to Mr. Zeller and to the FDA. Let the experts do the research, let them come to the conclusions they do based on the research, and then make sound public policy. That's what this legislative body did with the Clean Indoor Air Act. The studies were done, and the policy was adopted based on those studies. It's like one of the representatives said, is putting the cart before the horse. So we would encourage you to let that scientific research continue. It is continuing as of now and will with the FDA, and let that be concluded before a decision is made. Thank you.
Thank you, Mr. Bryant. Mr. Bryant, so I would ask you what I asked Mr. O'Rourke. Is there nicotine emitted in the vapor? Can it be emitted in the vapor?
Madam Chair, I've read one study where they have detected very minimal amounts of nicotine in the vapor, along with a lot of water vapor. Most of the vapor is water vapor, but there may be trace amounts of nicotine. I've read that in one study, yes.
So, Mr. O'Rourke, Mr. Bryant, I guess you think that, well, let me just ask you, is it okay with you then to expose people who are not voluntarily exposing themselves, but simply are indoors in a public place? Is it okay for them to be breathing traces of nicotine without knowing it, simply because other people are just, we're balancing interests here, we're balancing rights, there's no question about it. But is my right as a non-smoker, as a non-user of nicotine, less important than somebody else's right to be vaping wherever they want to be when they can go outside and vape?
Madam Chair, you have to look at traditional cigarettes, which are burned, and e-cigarettes, which just heat the liquid and create the vapor. As Mr. O'Connor stated, the true health impact of smoking traditional cigarettes comes from burning the tobacco. It creates the tar and all the chemicals that create health problems. In an electronic cigarette, there is a battery. It heats the liquid nicotine and then gives you a vapor. The trace amounts that the study referred to also indicated that there should be no harmful health issues because of that trace nicotine in the vapor if it's there. And I'll be glad to send all the members of the committee this study. It was done through the Drexel University and was mentioned earlier. And they came to the conclusion that it's not harmful for others because the trace amount is so negligible. If it was significantly higher, there may be a health impact, but not based on the study's conclusions.
All right, thank you, Mr. Bryant. Well, obviously, we're not here to convince each other. Let's see. But I would just say that, nicotine, as Dr. Ellinger testified, is a highly addictive substance. And we've heard testimony here today that there isn't a lot of quality control around what's in the various canisters that are vaped. And so I think it's, I would just say that from my point of view, to have people, myself as a non-smoker, it's one thing to compare smoking to these products, and I don't think we're here to argue that. It's about whether these products should be allowed to be used indoors in places where smoking is not. And I think that as long as people are being involuntarily subjected to the vapor, if it has a highly addictive substance in it, to me that is a problem. Representative Albright.
Thank you, Madam Chair. I'm just wondering, in your testimony, you described the content of the vapor itself, and I'm wondering if we can have a conversation or answer about is there a regulatory, as we would compare other either secondhand smoke, whether that be from cigarettes or others. And let's just deal with regular smokes. Is there a threshold of nicotine per million parts or billion parts that is a basis for discerning a cause and effect causation for cancer in regular cigarettes? And would there be any study or factual evidence on the books already about e-cigarettes that would be along those same lines?
Mr. Bryant.
Madam Chair, Representative Albright, not being a scientist, I would have to defer that to the FDA studies. They are right now studying e-cigarettes, the vapor that comes out of them. That's what these tobacco research centers are supposed to be doing, and they'll develop the answers that you're seeking. I don't know myself. That's got to come through scientific study. There has been one study, the Drexel study, which I'll provide to you, which said there was some nicotine in the vapor, but not at a harmful level.
Okay, members, we have reached the end of our time now. I just want to remind members that it is my intention to remove Section 1, so I want to let the audience know that. So we're not going to vote to pass or to pass along Section 1 at the end of the hearing. I don't know if that will influence anybody's decision about whether to come back this evening. Representative Zerwas?
Madam Chair, I was just going to make the suggestion that you let the audience know what Section 1 is. They may not be clear what the text of it is, just so we're as clear as possible.
Okay, thank you, Representative Zerwas. Appreciate that. So Section 1 of the bill is the section that adds e-cigarettes to the Clean Indoor Air Act. So that is the section that we are not intending to move today. So just so the audience is aware, does that help, Representative Zerwas? Okay, and so, members, we're going to be in recess until 6:30 or the call of the chair, and we will return to this room at that time. So, thank you. We stand in recess.